Good afternoon, everyone, and welcome to today's press conference to get an update from Northwood. I am Tara Wickwire, your moderator for today. And with me today, I have Janet Sim, who is CEO of Northwood, Josie Ryan, who is the Executive Director of Long-Term Care at Northwood, and Vicki Sullivan, who is the Executive Director of Operations for the Central Zone for the Nova Scotia Health Authority. So we will have 30 minutes today, and we'll hear some upfront remarks and an update from Northwood. And from there, we can go to the Q&A portion. And of course, as most of you know, the mechanism for asking questions is to go to the Q&A box at the bottom. And please, if you could put in your name and your outlet and what your question is, and I will pose the questions to our participants today. So with that, I will hand it over to Janet Sim.
Good afternoon, everyone, and thank you for joining us today. I'm Janet Sim, CEO of Northwood. Before we begin, of course, I'd like to express our deepest sympathies to those who have lost loved ones as a result of COVID-19 at Northwood and in the province and throughout the world. Our heart particularly breaks here every time we lose another Northwood family member, and our thoughts are with their families. We'll miss their beautiful faces. Today, we'll update you on our situation at Northwood and the safety measures that we have in place to protect our residents against COVID-19. We have worked very hard with our team here at Northwood, the Nova Scotia Health Authority, the Department of Health and Wellness, and many colleagues across the healthcare system to manage this outbreak. These have been very challenging times, but I'm truly inspired by the tenacity and commitment of our healthcare heroes. Many people have answered the call, and we're so grateful for this support. A recent example of this is a team of medical students who are joining us from the Dalhousie Medical School. We're also adding physiotherapists and speech pathologists to provide a range of support services to our residents. Each new colleague is a welcome addition to the team. We also need to thank our colleagues at the IWK, Nova Scotia Health Authority, DHW, VON, EHS, and so many others who stepped up and are supporting our residents. We're actively monitoring our staffing levels and managing as best as we can as it ebbs and flows and as we respond to the daily changes. All of the help that's been provided is greatly appreciated. I can't say enough about our hardworking team. We're so thankful for the generous donations from local restaurants like Eastside Mario's, Swiss Chalet, and Subway, who recently provided meals to keep our staff nourished, but even more important, to send a message of encouragement and support. Our staff loved the donation from Skin Fix of hand repair cream. No Frills provided refreshments and healthy snacks, and many organizations are helping by donating masks and other personal protective equipment. Every donation through the Northwood Foundation, big and small, gives the hope and support that our staff need right now to continue to provide the very essential care to our residents. I'm very encouraged by the continued support we're receiving, so from the bottom of our hearts, we thank everyone. I'd like to now summarize our daily update for today, which will be available on our website later this afternoon. We're of course devastated by the number of deaths associated with this virus. Many of our residents need end-of-life care, and our team are experts in providing this special care. Supporting families as they lose loved ones is a sad yet beautiful part of the work that we do every day. Given the size of our facility, we typically see 10 to 12 deaths per month, and we mourn each and every one of those losses with their families. Many of our residents are frail with many health complications, which make it very difficult to fight this virus. We're fortunate to have experienced hospice nurses who respond to end of life and support our staff to comfort and ease residents through this illness. We've had some questions about why our daily case numbers are sometimes different than what we see reported by the province. It is complex, but the easiest way to explain this is that our numbers of cases here at Northwood and the total number of cases in the province are data that are reported at two different points in time. So you can't necessarily compare our numbers to the total case numbers in the province. I hope this helps to address some of the confusion around this reporting. For our daily update, we currently have a total of 281 facility cases. When we break this down, we have 208 resident cases, that's 9 new cases, and 73 staff cases, that's 2 new cases. Sadly, we have 1 additional death to report today. We have been in touch with the family, and our hospice team is offering support. We extend our deepest sympathies to that family. We are excited, however, to report that we now have 10 people in the offsite recovery unit, with another 2 to 4 people being evaluated today, and hopefully they will transfer over. We are seeing a significant number of our residents recovering from this virus, which is very encouraging. We look forward to transferring even more residents to the offsite recovery unit. These moves will give us more flexibility to move our residents into individual rooms within the facility and to create recovery units within the facility. These transfers can happen so long as residents are symptom-free for the required amount of time, and we're taking direction from Medical Officer of Health regarding that definition of recovered. Family members who are looking for information about their loved ones can reach us at northwood@nshealth.ca. To deal with the ongoing COVID-19 situation, we've had to recruit many new staff from outside of Halifax. Their contributions have been invaluable, and we thank them for every moment they have to give. Unfortunately, many of these new staff members have been unable to secure short-term rental accommodations in the city. I understand these are very difficult times for landlords as well, but I would urge them to offer short-term leases for the brave people who are coming from outside of Halifax to assist us in our time of need. I thank the landlords for their consideration and help in this matter. We'd also like to thank the local hotels that have stepped up and have been accommodating our healthcare heroes. They've provided such hospitality and welcoming. It's been an amazing experience. We've also had a number of questions about our Halifax campus and what we're doing to ensure the safety of our residents and our tenants who live in our independent apartments. We've done a lot to manage this infection and have strict infection control measures in place. Our approach has been reviewed by infection control experts, and I'm assured that we're doing everything we can to prevent the spread of this virus. There are 2 buildings at our Halifax campus where tenants live, the Tower and the Manor. The Tower is attached to the campus to both the Manor and the Center through a pedway. This pedway has been locked for several weeks to limit traffic. Our Almond Street apartments are also considered part of the Halifax campus, but they are not physically attached to these other 3 buildings. In the Manor, there are floors that have both tenants and long-term care residents. They have separate wings within the building, and they are separated by physical barriers that have been in place for several weeks. Each floor has 2 wings, north end for tenants and south end for residents. There is a tenant-specific elevator, and we also have separate staff that provide services to a small number of the tenants in the Manor. People who live in our affordable retirement living program are tenants. These individuals are like any other Nova Scotian, and the Tower, Almond Street, and apartment section of the Manor are like any other apartment buildings in the city. These individuals are expected to follow public health orders for physical distancing. Access to all of our buildings is restricted. There are public health orders that guide the restrictions in long-term care, and Northwood has established clear guidelines for access to our apartments to ensure the safety of all those living on our campus is secure. In closing, we're encouraged by the support we are receiving. These supports allow us to focus on what's most important, of course, which is providing quality of care to our residents. We're so appreciative of the continued support from our healthcare colleagues, our residents and their families, our staff, and the broader Northwood community. We will continue our battle against this disease and do everything we can to provide comfort and peace for those in our care. Myself and Josie and Vicky are now open to questions.
Thank you, Janet. Okay, we'll move now to the first question. So this comes from John McPhee at the Chronicle Herald. And his question, the daughter of a resident said her mom caught COVID-19 from a roommate this week. Are negative and positive residents still being roomed together? So Josie, did you want to take that one?
Sure. We are separating residents that have positive and negative results when we have private rooms to put them in. Our experience has been that if somebody is negative in a room with a positive person, that they may be incubating the virus. So to move them in with somebody else negative, you put the other person at risk. So now we have the ability to move people around, and we are separating positives and negative people.
Thank you. So John's follow-up, he's asking how many new staff have been added, assuming these people are outside of the nurses from the NSHA. What's the total number of staff working at the facility now?
It changes daily. Today, staffing is extremely good. We have 4 CCAs, for an example, on a floor with an LPN and an RN, and then support from the team during meal time. So staffing is very good today, and that's only through all the support we've been getting through the external agencies.
Yeah. Tara, just to add to that, I think, from an overall perspective, there's about 200 individuals who've actually are in the schedule and working at Northwood. That's inclusive of all of the support from all areas. And in addition to that, there is close to another 80. There was a pool posting that was done, and there's probably another 80 that are in the queue to actually begin work at Northwood.
Okay, thank you. Taryn Grant from CBC, I see you had a similar question around monitoring staffing levels, so hopefully that will answer your question as well. If not, just let us know. Natasha Pace from CTV, is there more that government could have done to prevent this? Families are upset Northwood is the epicenter of the outbreak of this virus here. Josie, did you want to take that one?
Sure. So we did put things in place early in March, and I've gone through everything with infection control. We've worked with the MOH, et cetera. All of the preventative measures were in well before it was mandated. So on April 5th was our first case that we've identified in the building. We do believe, and I can't confirm because we'll have to look at the data as it proceeds, but it came in prior to that. We were a week ahead with masks for all the staff. So we're just coming out of that incubation period. So we're hoping that we'll see a decrease. The incubation period of 1 to 14 days means that somebody can have the virus and become ill anywhere in that 1 to 14 day period. So could we have done any more? Not that I'm aware of, because other nursing homes are doing the same precautions. Our Bedford location, our Shoreham location, we have no cases there. What we're believing is that there was issues in the community, and that community spread came in before masks were put on.
Yeah. The asymptomatic spread where individuals were getting through our screening with the typical questions that were in place at the time is clearly been our biggest challenge.
Okay. Natasha has a follow-up, and she is wondering how many staff are out with the virus.
I'd have to get the count today. Yesterday it was around 70, but we're also seeing up to 40 staff that have recovered and will be able to return to work.
This one from Olivier Lefebvre from Radio Canada. How many deaths happened at Northwood Halifax campus in April, both COVID and non-COVID? Do we have that number?
I do have the number. I just have to.
While Josie's looking that up, I can respond partially to that. We've been advised that even if an individual was at end of life prior to COVID or end of life for natural causes, that if they do test positive, they should be included in our COVID count. And that's one of the challenges, because we do, as we've noted, that we do have a number of deaths per month that are part of the natural life cycle here at Northwood.
So the reporting today is 22 deaths. And as Janet said, some people were at end of life prior to COVID related. So it is our medical director is reviewing all deaths, and we'll be reviewing them with the medical officer of health and with the infectious disease, just to determine the true cause of death.
Okay, very good, thank you. And Natasha, she just was wondering, do you expect to see more cases, or do you feel that you've reached your peak?
There are some floors that have a number of people that are positive and some people that are negative, and they're not in the same rooms. But we're anticipating, because of the incubation period, that we will see more cases. And as we are continuing to swab, and on an ongoing basis, like yesterday, we swabbed 66 residents and found 4 or 5 cases that were asymptomatic. So we're continuing to swab. And as we continue to swab, similar to in the community, the more you swab, the likelihood that you'll find cases is also possible.
Okay. So just another follow-up from Taryn Grant, CBC. So wondering why is staff fluctuating so much and why are staff coming in from outside HRM? Vicki wanted to start with that one.
I think from an overall perspective, a call went out to assist Northwood. And from a health system perspective, there were staff that are located within the central region who actually responded, as well as across the province. I think, and there's a number of different agencies associated, so Nova Scotia Health Authority, but a number of people who work in other long-term care facilities, I think, have answered the call, as well as people who live outside who've applied for positions to help during this time. So it's been a collective effort from a number of different healthcare professionals across the province. And it's not just even healthcare professionals. We've required additional housekeeping support and others that are critically important for the overall response. So it's been broad and it has included people from all over Nova Scotia.
Thank you. Question from Alicia Draus at Global. So looking for the total number of residents and that split. So how many are long-term care versus residents? Josie, would you have that?
I'm not quite long-term care versus residents. What is it, between staff and residents?
She's asking how many residents are there and how are they spread out? Maybe, Alicia, we can get clarification on that question. She did have another one. Last we heard there were 7 floors that were unaffected by the virus. Is that still the case?
So this morning we found a case on one of those floors. We have moved that person off the floor. And that's what we've been doing with these 2 floors. There's a second floor that had 6 new cases, asymptomatic, but when we swabbed the whole floor, there were 6 cases on that floor. So they wouldn't be considered clear right now. So we have 7 floors that are still unaffected.
Okay.
Yeah,
go ahead.
We have 208 resident cases that I've indicated, and those are all resident cases in Halifax long-term care. That does not include any of our apartments. We have no known cases of any of our tenants, and we have no cases in any of our other facilities. So those 208 resident cases are all Halifax.
Okay. Another question from Alicia around testing. Everyone was tested last week, but now we're seeing 20 new cases. Is that part of last week's extensive testing, or are these all people who initially tested negative?
Some have tested negative and been re-swabbed. So between Monday and Friday of last week, we've retested a lot of the floors. So some would have previously tested negative, but what we're seeing is that within 3 days, some of them can then turn positive. It just depends on the virus and how it's affecting them. That's the challenge.
Yeah. Okay. And then just one other question from Alicia. Have you been able to track how it's continuing to spread? For example, all the new cases, do we know how these individuals were exposed to the virus?
That's again another one of the challenges, because we don't know how they were exposed. When we first started and did contact tracing, you could look at the initial case that a staff member would test positive without symptoms. You go back and you test all the residents, you test the staff that they worked with. In one case, we tested over 70 people and nobody came back positive from that contact tracing. So that's why we believe it came in before we even knew it was in the building.
Okay.
And we make changes every day to our strategy based on what the data is telling us to try to get ahead of this. And it is a constant battle. And everything our experts are telling us, this virus has certainly challenged, and we continue to work with that expertise and that advice as we look every day to new strategies to respond.
Thank you. Yes, and the split she's looking for is long-term care residents versus tenants.
Yes, the report that we were given, that's all residents in long-term care. Those are no tenant reports. We've got no reports of tenants being impacted by this.
Okay. So from Taryn Grant at CBC, when will you consider the outbreak to be under control and no longer an emergency?
That would be based on the MOH. So as we work with the medical officer of health, they would declare any outbreak. If you hear in the news now that there's 10 homes, even though they don't have cases right now, the outbreaks haven't been declared over. There's the incubation period, et cetera, the 14 days. So it would be in discussions with the MOH, and they would decide when we have it under control and when it's cleared.
Okay. So this one from Olivier Lefebvre at Radio-Canada. Would you say a better secure place for non-positive residents would be to be taken care of at home at this point? And why or why not?
A lot of the residents still have significant care needs. So outside of COVID, there's a lot of people that are unable. That's why they come to long-term care, because they can't provide the care. They're unable to ambulate, so they need a lift to be able to move. They have many comorbidities with the dementias. People with dementia, affected by dementia, can be exit seeking, et cetera. So they come to long-term care for a reason, because they can no longer be cared for at home. So very challenging for somebody. If you look at somebody that's 90, 98 years old, their children may be in their 70s.
Okay, thank you. So another one, this is Heloise Rodriguez from Radio-Canada. Can you give us a better idea of the testing you were doing? Do you swab residents every single day? So let me remind people of that.
Yeah. So we're meeting again at 3:30 with the medical officer of health, given that we just swept the whole building and we are still doing testing for staff every Tuesdays and Thursdays. They'll give us their direction on what we should be swabbing and how we should be swabbing. So we'll know more at 3:30 this afternoon.
Okay. And then Alicia Draus at Global, she's wondering how many people are there in long-term care?
In our long-term care facility, we have bed capacity for 485. Because of vacant beds, we had 469 when the outbreak began in April.
Okay. Another one from Taryn Grant at CBC. Federal and provincial politicians say long-term care delivery will be re-examined post-COVID. How will Northwood examine its own operations after COVID, and what do you think can be learned?
I think there's lots of lessons learned from this outbreak, even in our structure itself, but also in how we provide, even how we give medications, et cetera. We have extremely good practices, but some of those practices will all be evaluated. We've evaluated how we do medications, how we do personal protective outbreak situations. This is a different virus. We have been able to contain influenza, gastrointestinal outbreaks, but this virus has had so many different intricacies that I think the medical team that's working with us, Dr. Shelley McNeil from the QE2, who's head of infectious disease, Dr. Rockwood, who's a geriatrician, all of those key players are actually working with us, and there will be lessons learned, absolutely. And look at if this virus does come back, how do we better position ourselves for it?
Right. Okay. So then her follow-up, what can be done quickly to prepare for a second wave of the virus?
What we're doing right now is building a capacity for private rooms. So as we get a vacancy or someone moves to the transition unit, we use that room wisely and separate people that are in shared rooms.
Right. That was the last question I had. So I think that is all we have from our media here today. A reminder, we are posting daily updates on the website. They're comprehensive. We will also post a recap of this press conference, and it's at nwood.ns.ca, and you'll see the COVID section very clearly on the website. So thank you to everyone here today, and we will be continuing these updates, and yeah, advise you to visit the website to follow along on most current information and updates. So thank you all.
Thank you.